Let's test your clinical chemistry knowledge. When preparing a patient for an oral glucose tolerance test, OGTT, which of the following conditions will lead to erroneous results? A. The patient remains ambulatory for 3 days prior to the test. B. Carbohydrate intake is restricted to below 150 grams for 3 days prior to the test. C. No food, coffee, tea, or smoking is allowed 8 hours before and during the test. D. Administration of 75 grams of glucose is given to an adult patient following a 10 to 12 hour fast. Think carefully. What's your answer? Correct answer is B. Carbohydrate intake is restricted to below 150 grams for 3 days prior to the test. Explanation: to ensure accurate OGTT results, proper patient preparation is crucial. Let's break down why option B is the correct choice, and why it leads to erroneous results. The oral glucose tolerance test measures how well the body processes glucose. For a valid test, the patient should eat a regular, carbohydrate-rich diet, at least 150 grams of carbs daily, for at least 3 days prior to the test. If carbs are restricted below 150 grams, the body enters a temporary glucose intolerance state, and the pancreas may not respond normally. This can artificially elevate blood glucose levels during the test, leading to a false positive diagnosis of impaired glucose tolerance or diabetes. Now let's look at the other options. Option A, being ambulatory, maintaining regular physical activity, is actually recommended. It reflects the patient's real-world glucose usage. Option C, avoiding food, caffeine, and smoking for 8 to 12 hours before and during the test is mandatory. These can interfere with glucose metabolism and insulin response. Option D, administering 75 grams of glucose after a proper fast is the standard OGTT protocol for adults and part of World Health Organization and other guidelines. So remember, for valid OGTT results, always advise your patients to maintain a normal diet, particularly in carbohydrate intake, in the days leading up to the test. If you watched till the end, drop a test tube in the comments so I know you're one of the real ones.
I shared my knowledge, now it's your turn. What's one tip or fact you know about this topic? Let's build a learning circle.